being here. Couple housekeeping pieces. If you haven't already, and we'll say this throughout the meeting, if you haven't already signed in the chat and put your name as well as whether you're a DDS or a hygienist or who you work for, or that you're a private practice dentist, please let us know, because that's how we're given our CE if you need CE. So go ahead and put it in the chat room. And if you have questions, we're doing this as a Zoom meeting, not a webinar. So if you have questions, they will also go in the chat room. And both Jen, wait, raise your hand wildly and say hello. Hi. Jen is there. She's now has a yellow box around her name. She's our SDDS team member. She's watching the chat room. And Noelle, raise your hand wildly. There she is. And she's going to keep us honest and on schedule too. Okay. All right. So welcome. Thank you very much. This is our dream special needs meeting that I've been trying to do for about the last 3 years. So I'm glad we could do it via Zoom. Noelle, could you please thank the sponsors?
Absolutely. So today's class is sponsored in part by Every Smile Counts, Liberty Dental, Access Dental, and HealthNet.
Okay, roll call.
Wave wildly. I saw Danielle wave. There we go.
Okay. Liberty Dental.
Thank you so much for your support.
Seriously, thank you very much. Every Smile Counts is the Sacramento County DTI that we're partners with. Robin Alongi, are you here? You might be driving the car.
So, I am here.
She is here. All right. And thank you, DTI, for making this happen with us. So we have, thank you. She's happy to do it. Did y'all hear that? Okay, awesome. So how tonight's going to go is we are going to introduce our speakers, and we're going to do a short bio and introduction for all our speakers, and just tell us a little quick bit about your history, not your life story, but just your history, your practice, where you come from, what you do. And I have 10 minutes allocated for this. So first one, and then we'll go to the presentations. So Mary Rittenhouse.
Hi, good evening, I should say, not good morning, right? My name is Mary Rittenhouse. I'm with Alta, California Regional Center, which is located here in Sacramento. I'm the autism clinical specialist for the regional center, and we serve about 26,000 individuals with developmental disabilities, including autism, CP, epilepsy, and disorders similar to and or intellectual disability. And I've been working in the field of developmental disabilities for about 15 years now in both the private and public sectors in home and community-based settings. It's nice to be here.
Thank you, Mary. Did y'all hear her okay?
Fine.
Okay, good. Thank you. All right, Dr. Rodney Bughao.
Yeah, I'm Rodney Bughao. Went to school UC San Francisco way back when, did a hospital residency, came to the Sacramento area about 1991 and started treating patients in the operating room setting at that time. Most of my patients are people with developmental disabilities, although we do get some people with significant medical issues as well. I work in hospitals, Sutter, Kaiser's, a couple surgery centers around Northern California.
Thank you very much. And you are a proud SCDS member, correct?
Yes, I am.
No, thank you very much. Okay, Dr. Acheson.
I'm also a proud SDDS member.
Thank you.
Let's see, graduated dental school 79, had a hospital residency in the Air Force, came to Sacramento in 1982. I've been practicing in, same as Rodney, Sutter Hospital, Kaiser Hospital, surgery centers ever since. I'm in a 3-dentist practice, American River Dental. We all are unique in that we all do intravenous, all forms of sedation in the office. And that's my primary practice. The hospital practice is probably about 25% of my practice. And my goal in hospital dentistry is to do everything exactly the same as I do in my office, that there are no compromises working in the hospital as far as range of services or the way that we do things. That's it.
Thank you very much. And our next presenter is Sonia Bingaman.
Hi, thank you so much. My name is Sonia Bingaman. I'm with the State Council on Developmental Disabilities, and I'm the manager of the Sacramento Regional Office, which covers our 10 counties around Sacramento. I started in the field in 1989, doing supported employment and helping folks with developmental disabilities find jobs in the community. Later worked for 10 years as a service coordinator at Alta Regional Center. And then I've been with the State Council on Developmental Disabilities, advocating for people with disabilities in all areas, including dental and healthcare, and been more involved with dental issues since about 2014. So just glad to see this actually taking place and all the momentum that's happening in the community about addressing this issue. Thank you.
Thank you. Okay, Donnell, Kenworthy.
Hi, I'm Donnell Kenworthy, and I'm a wife to 1 and a mom to 5 and a grandmother to 10.
Wow.
And we're adding foster grands as we go along. So, but my son, my youngest, DJ, I wanted just to kind of share a little picture here so we can get it on there. DJ introduced me to the world of special needs and disabilities. And DJ has autism and Down syndrome and a wealth of medical needs. And Dr. Bughao has been his dental provider here in Sacramento since we moved here when he was 3. And I've served in different capacities in the community. One of the things that I love is being on State Council on Developmental Disabilities, working with Sonia Bingaman. And that was my introduction in working in the arena of advocacy in dental care. So DJ and I were featured in, we got to speak to the Little Hoover Commission, and our testimony was in the Little Hoover Commission's Dentacal coverage publication. And we also serve for the Sacramento MCDAC here, and my husband on the committee and I on a work group. So it's a big part of our lives. Thank you for letting us be here today.
Thank you for being here. Jim Morris, Judge Jim Morris.
Ex-judge, retired judge.
Retired judge.
Yes, I'm Jim Morris, and I worked for 17 years as a prosecutor in the Sacramento DA's office, after which I was appointed as a judge of the Superior Court. That was from 1984 to 2005 when I retired. Had my Parkinson's diagnosis in 2008. And I could tell after I was diagnosed that it went back and started a few years prior to that. I've been involved with the board of directors of the Parkinson Association of Northern California and a few support groups. So I'm here as a voice for the Parkinson patients and in response to some of their questions of us. And I don't have as many grandchildren as Donnell does, but I have 1 wife, 2 sons, and 5 grandkids.
There you go. Okay, thank you. Liberty Dental, can you guys just tell us briefly why you're involved and what you guys are doing with special needs? I'm putting you on the spot, sorry.
I'll take the reign. My name is Danielle Canarazi, and I am the Community Outreach Manager for Liberty Dental Plan. We also have Dr. Sakari on the line, who is our California Dental Director, as well as Lisa Rufo, and she is our VP for Provider Relations for California. So what we do in regards to Sacramento County and our special needs population, we are one of the 3 dental managed care plans. So if individuals in Sacramento County, Medi-Cal individuals, if they are on Medi-Cal, they are either assigned to Liberty Dental Plan, Health Net, or Access. So what that means is we serve the special needs population for dental. And we're really trying to do better. Really, we're trying to figure out how to better help our families and their our members, their guardians. And I've gotten to do some desensitization presentations with Sonya and with some adult groups at adult daycare centers or day centers before COVID. And so we actually did one virtual as well. So we're trying to empower individuals to, learn how to, those that are able to, brush and take care of their teeth and just really learn what we can do better moving forward to better serve our members and who are the special needs population.
Okay, thank you very much. Is somebody here from HealthNet? I don't think so. Okay, perfect. So we introduced the room, done, check that off. And I think we will start. I want you all to know there are some people here from Napa and Santa Rosa because we outreach to all areas. And although this is why SDDS is sponsoring this, and we are providing CE credit to dental professionals. This is not specific to Sacramento at all. And so just want to make sure that the information gets to whoever needs it, wants it, or needs, is asking about it. So with that, I'd love to toss it to Mary.
Okay, awesome.
Okay, Mary.
Let's talk about autism. And before we get started, just since I'm not familiar with this particular group, I'd love to see a showing of hands. So if you all can go to the reactions or maybe it's in participants and raise your hand if you are familiar with autism and to show me you're listening.
So if you go to reactions and do thumbs up, you guys all know how that, you see that? Go to reactions on the right and thumbs up.
And I'm seeing some raised hands in the participants, so that's awesome. Okay.
Cool.
So, and what I will say is, 10 minutes is going to be very quick and dirty overview of autism and some evidence-based practice strategies. Usually when I give this talk, it's more like an hour and a half. So if anyone really wants to do a deeper dive, we are open to hosting that for you as well. Feel free to reach out after this presentation. And so as we stated initially, I'm Mary, and I'm the Autism Clinical Specialist at Alta Regional Center, which serves about 26,000 individuals with developmental disabilities, including autism. And what is autism? Well, some of you have already stated, you're familiar with it. And the definition that I most like, and there is a more technical definition offered in the DSM-5, of course, but the definition that I really prefer is the definition offered to us by the Centers for Secondary Education, which really describes autism as a developmental disorder that impacts the way individuals communicate as well as interpret their environment. And so then that often leads to challenges such as with social interaction and processing certain types of information. And most of you, if you've heard of autism, it's called autism spectrum disorder, right? And it's called a spectrum disorder because it really varies from individual to individual in terms of how symptoms are displayed, in terms of severity of symptoms, types of symptoms. But I also like to think of it as a disorder with multiple dimensions, including intellectual ability. So if you want to think of kind of a crossbar, if you will, where, intellectual ability is here from high to low, and then you have a spectrum across here for severity of autism symptoms, you kind of have individuals in all four of those quadrants, right? So you have highly intellectual, verbal individuals, and then we also have people that engage in a lot of repetitive and restrictive types of behaviors and maybe don't have expressive forms of language. approach. So it really does look different from person to person. And so the strategies that we might use to address those needs are going to obviously differ from person to person. And just to give those of you that maybe are less familiar with autism some more concrete kind of ideas of how that looks or what you might experience is you can imagine in a dental setting how if I know when you tell me to open my mouth, right, you're about to stick an instrument in it probably. However, an individual with autism might not relate those two things together, right? So they might be very surprised by you putting something in their mouth. So you might also have to use what I've seen referred to in the dental literature as the tell, show, do method, right? I'm going to tell you what we're going to do. I'm going to show you the instrument. I'm going to tell you I'm about to put this in your mouth, right? Very step by step, very concrete is a beneficial way to work with individuals that have developmental disabilities because of that lack or potential lack for ability to understand those environmental cues and what that means. They might not even notice that because of your apparel, you're a dentist, whereas, I would know that, or know that a badge on a police officer indicates that that person is in law enforcement and I should listen to them, right? So, and we've seen some unfortunate incidents due to that. And so some other ways that we see autism, I would say, primarily affect individuals when it comes to accessing both medical and dental care is one of the key characteristics for individuals with autism is kind of a rigidity, right, with scheduling and with routines. And so a medical appointment in any of our days is kind of a disruption to that anyway. So it's not something that we expect to happen on a regular day-to-day basis. So you're already kind of fighting an uphill battle sometimes when it comes to, okay, now today, there's a dental appointment in there. So that's one strategy, or that's one way that it can impact, I would say, an individual's experience and also your experience as a practitioner with what you're receiving when that person might enter your practice. And then some other kind of concrete examples I would say would be things like, taking things very literally, right? And not maybe understanding the social nuances of some forms of communication. So if I was to say, I'm feeling under the weather today to a person with autism, that might be very confusing because they might literally think I'm under some kind of rain cloud or something, like we see in the cartoons. And so when we've reviewed the literature in terms of what dentists feel like most impacts their experience with individuals with autism, what we really see is the primary issue, though above it all are the behaviors. And what do we mean by behavior? Because everything's a behavior, everything we do. And what we mean by that are some types of harmful behavior on occasion. Property disruption or destruction, aggressive or assaultive behavior. The individual might grab you, bite you, pull your hair. Self-injurious behavior on occasion. We see these kinds of behaviors, or even behaviors just like restrictive or repetitive self-stimulatory type behaviors. So rocking, hand flapping, things like that might make it difficult to engage with an individual on a physical level. If I'm, flapping my hands here in front of my face, you need to get to my mouth. That might make things a little bit difficult. And so what I wanted to just briefly touch on here today, and I was going to share a screen, and then I thought, well, you know what, I'm just going to since I have these things, I'm just going to put them up on a board so I can actually interact with the materials. But one of the nice opportunities we do have with individuals with autism is that we have a collection of evidence-based strategies to address both behavior as well as skill deficits. And these things are not rocket science. These are things that anybody can do. We teach parents, family members to do these things all the time. And so some of the things that we know from the literature that are nicely tailored for something like medical or dental appointments are some of these things that I'll just kind of draw reference to here. So things like, if you can see this, a basic just reinforcement procedure with a visual, right? So first, I'm going to have my dental appointment. Then I might get something like my iPad time. So having this available, bringing this with them with some other choice opportunities, maybe a trip to the zoo or some other fun things that might follow, some pizza, I don't know, that might be helpful. And some folks might just need something real basic like this. And some individuals might need something a little bit more broken down, and they might need to see how they're progressing through each of the steps, right? So they might need to get, you know, a check or a smile or some kind of indicator going, okay, we waited in the waiting room. Now we're going to go into the chair. Now we're going to put the sunglasses on, and then all the way till we get the reward. So could be a very basic first, then all the way to we're going to give you a little idea of how you're doing on each step. And then for at home, to increase dental care, you might recommend something like a real basic sticker or reward chart, right? Where you're just kind of having something visual where you can say, oh, great, you brushed your teeth Monday morning. And then when this is all filled up with stickers, maybe that means something for the individual. Things like communication indicators for those that are nonverbal can be helpful, so that the individual, you can check in. You can say, how are you feeling with this procedure right now? Are you okay? Are you great? Do you need a break? Do you want me to stop? And having these visuals, I will say, they can be miraculous at times. We had a very escalated individual in our lobby before COVID, who was, you know, in full destruction mode. We brought out some of these visuals, and we were able to de-escalate the person very quickly because we were able to then communicate with him. Some other things, mini schedules for at home, for example. You can print one of these up, laminate it, and put a sticky magnet or a Velcro on it and tape it to your, you know, your mirror in your bathroom to indicate the steps for brushing teeth. Or for someone that is a reader, we might have them listed here. Or, you know, for our adult consumers, something more realistic with instructions how to floss. And these, we have these as well as some other examples like social stories, as well as video models that have been pre-made, all accessible. I have in a Google resource folder if anyone's interested in incorporating some of these things. And you know, I'm probably getting done with time here, but I'll just quickly touch on I guess a question I would have as a practitioner is, okay, well, you have these variety of strategies, but how do I know what to apply for who or what to recommend for which individual? And so we also have developed a basic kind of screening questionnaire that has a little bit of a rating tool to give you an idea of the level of individual support needs. That might help you make those decisions as far as, do we need something real basic, just like a first then, or do we need something a little bit more structured and detailed? So, and I'm happy to talk more at another time, but I want to make sure we give everyone else an opportunity to chat. I think our moderator left. Maybe it's okay for me to keep talking. Okay, then I'll mention one more plug. So another entity that I'm a part of is called the California Autism Professional Training and Information Network, also known as CAPTAIN. And there are a variety of resources available to you if you're interested through their website at www.captain.ca.gov. We're happy to offer that to you, as well as if anyone's interested in a professional professional mentorship with UC Davis Mind Institute. They're offering a free program right now. It's called the Autism Echo program, and they may even be offering CMEs for that. But you can receive, it's for physicians, nurses, anyone in the medical field. I'm sure they'd welcome dentists, and it's really a professional opportunity to get more hands-on support and guidance with working with individuals with special needs. So,
Mary, can you put those links in the chat, please?
yes, I will.
Thank you.
Awesome. So raise your hand if this is your first Zoom meeting. Oh, you guys are all so good. This is awesome. How many of you are Zoomed out? Yeah, it's going to go on for a while. We might as well make the best of it. Okay. So next, thank you very much, Mary. You're right on time. You caught me leaving for a moment. So good. Strang, thank you. Okay, so Dr. Acheson, you are next.
Oh boy. Well, it was good to hear from Mary. It would have been nice if I would have talked to Mary 40 years ago, but I didn't have a Mary. Well, the first 10 years of my hospital practice were pretty typical for, I think, a hospital practice. I rarely saw the patients before we went to the hospital. Everything was kind of done over the phone, doing pre-authorizations, getting them scheduled. I meet the families just before we go into the OR. And then I generally wouldn't see them again until they came in 2 to 3 years later with a whole new mouthful of decay. So that was really distressing to me because it's such a heavy lift to get these patients in the office in any way, and to get them to the hospital is just an amazingly difficult process. So after about 10 years, I decided I had to do something different. And I've been interviewing the parents. I started interviewing all my patients before I would take them to the hospital, and just trying to find out more about them and how they came to me. And I was pretty distressed. Virtually none of these families had any preventive routines, effective oral hygiene routines at home. Virtually none of them, and all of them were referred from other dentists, at least the families claimed they hadn't received virtually any oral hygiene instruction. None of them came in with prescriptions for high fluoride toothpaste. They didn't know what fluoride varnish was. No one had actually made them demonstrate how to brush teeth. A lot of them didn't know how to approach doing oral hygiene in most of them children's mouths. They were afraid of hurting them. The kids would fight back. It was just a battle, and the kids were losing because by the third cycle in the hospital, I was extracting teeth. You can't fix them anymore. So I made a change, and I'm a dentist who believes in the dental home concept. So every one of these patients, I strongly advise them to come into my office to have fluoride varnish applied every 90 days, just like clockwork. And what I learned, because I didn't have a Mary to instruct me, is that routines and repetition are very important in these individuals' lives. And we're talking mainly autism here. But I observed over the course of a year, behavior changes in most of these individuals where they actually started looking forward to coming to the dentist because it was part of their routine. They heard the same voices. They smelled the same smells. I'm sorry.
And this is why I asked you, Dr. Acheson.
It was an epiphany. And this is how I would advise any dentist who's thinking, I have to calm down here. Any dentist who's thinking of incorporating special needs in their practice has to learn how to interact with these individuals, where you can actually, instead of looking them at as a tornado coming into your office and disrupting everything, where your routine's out the door, they start behaving better. You really look at them as individuals and can discern different personalities. It was transformational. But the other part was getting the parents involved and really making it a serious effort at prevention. And I believe in show, tell, do. And these parents or the caretakers they have to demonstrate how they're cleaning these kids' teeth, and they didn't know how to approach them. They're usually face to face or struggling. And I learned over the years what techniques to approach a patient, how to brush their teeth worked. And by the end of a year, 2 years of them coming in routinely, and now the parents doing effective daily oral hygiene and learning how to touch them and hold their lips and pull things out of the way, I have patients that now I can do things in my office that were impossible before because the patients aren't afraid. They're used to having fingers in the mouth. They're used to how things smell and taste. And the majority of those patients I've never taken back to the hospital, except perhaps, you know, in 5 or 10 years, it's just time to do an exam and they can't tolerate taking x-rays. And we just have to take them there so we can get a decent exam, clean their teeth well, and really benchmark them. That's my term, benchmarking. So I think that's pretty much how my practice evolved. I'm kind of unique now in that all the patients get interviewed before I even decide to accept them as patients. I believe I have to have a supportive family. A train wreck that comes in that doesn't have any support, you know, as a compassionate dentist, I'll do my best to stabilize them, but complex dental treatment is not going to happen unless they can demonstrate effective daily oral hygiene, so that I'm pretty well assured that once we repair a tooth, it stays repaired. People just have this attitude that once a tooth is fixed, it's never going to need treatment again. Well, that's crazy, but it's just a common perception. So I think that's my main message. I think Kathy was asking mainly how other dentists could tiptoe into this. The other thing is, I think there has to be a real clear dividing line on what's doable and what's practical in an office. And as a young practitioner, you're very self-sacrificing, and I'll break my back and break my neck and do everything to try and work with a patient. But you're abusing your own body, and you're abusing the patient to some regard. And there does come a point where the complexity of the treatment, or the length of time it takes, or the amount of restorations that need to be done, I think general anesthesia dentistry is really the most ethical and humane way to resolve the problem. And then you start fresh with a patient that's out of pain, and you can start doing all the preventive stuff. I don't know. I think that's my main message. Who has questions?
So do we have questions? We're watching the chat room, and just as a reminder, if you came in a little bit late, please sign in on the chat room and let us know if you are a dental professional, or you're just an interested person, or you just have a heart for this topic and for the kids and the adults out in the community. I am as passionate as Dr. Acheson is. We get so many calls at SDDS from parents of adults as well as kids, and the feeling out there is people are afraid of my kids, or people are afraid of my father, and you know, I don't want to take them to the hospital. I want a compassionate, welcoming experience at the dentist. And so the goal of this night is to say, as I said in the write-up, it's not yours to be afraid of this. It's yours to learn more about it and to open up your hearts in your office. So
I have some more things to say. You've stimulated some thinking.
Cool.
So one of the other things that's developed in my practice is I absolutely forbid restraints. There is no restraint in my office. There are no blankets. There are no papoose boards. There's no Velcro straps. I do not allow parents to hold hands. My assistants are not allowed to do a body slam to hold a patient down in the chair. That will never happen. And the reason is, the majority of my practice are sedation of normal people in my office who are afraid to come to the dentist. They're terrorized. And their story is virtually the same. It's like listening to the Grateful Dead album over and over and over and over. They were hurt as a kid. They were restrained in the dental chair while dentistry was being done. The restraint comes in all different flavors. It can be from a parent's point of view, trying to be compassionate about just holding them down to get things done because nothing else can be done. The papoose board, I think, should be burned. I have very strong feelings about that. And so if we can't work together, do desensitization and coming into the office and working together, then I think general anesthesia is the way to go. The patient that doesn't have any memories of people being in their mouth, being hurt, the smells, that I think is a real core part of me. Thank you.
Thank you. Again, any other questions? We'll take questions as we go for Mary or Dr. Acheson, and we'll also have time at the end. We have a whole half an hour I planned for the end. So anybody have any questions for Dr. Acheson before we move on?
There was a question in the chat for Dr. Acheson from Tammy. Do you work with very medically fragile patients?
Yeah, my hospital practice is probably half and half special needs and, you know, like Parkinson's, cerebral palsy, Alzheimer's, very medically compromised people. So the answer is yes. That's probably the most challenging part because there is a point at which you have to make a judgment call about whether it's safe to go into the hospital or not. General anesthesia has really changed. In the 40 years I've been working in the OR, it's a very different animal. I think Rodney can speak to this too. But when I started, anesthetic agents were ones that were real fat soluble. They'd soak into the body. It could take a week for a patient to really recover from general anesthesia. The anesthesiologists weren't comfortable. When a patient has general anesthesia, you have to put a breathing tube down their windpipe to protect their windpipe and to breathe for them. And usually that goes through the mouth. But as a dentist, that just doesn't work. So the breathing tube goes through the nose. And that is a skill that many anesthesiologists just do not have. And so part of my responsibility is recognizing what anesthesiologists should not be doing dental anesthesia and helping train the anesthesiologists on how to do it better. And we're at a point now where I'm pretty comfortable with virtually all the anesthesiologists in the Kaiser system and the Sutter system. And the anesthetic agents that we have now, literally the patient is awake within 5 minutes from the time I'm done. They just turn off the drugs and they're waking up. So it's been transformational. And I really wouldn't have any misconceptions or ill feelings about my children or my wife having general anesthesia the way it's practiced now. So
it's true. It's true. Okay, thank you very much. Any other questions? We'll move on, and again, we'll have time at the end. And again, if you're calling in from a phone, we don't have your name. So if you could make sure you sign in and just write called in from phone, we'll be able to trace you and track you down. Otherwise, we'll call you tomorrow because we now have your phone number. Okay.
Kathy.
Yes.
Before we move on, Jan Ressler has a question for Dr. Acheson. If you could change one thing about the system, what would it be?
Okay, soapbox time. There are nothing but barriers in the way to do dentistry in the hospital system. But I have to give great kudos to the Kaiser system. Kaiser used to be the most opaque, ridiculous bureaucracy that I've ever encountered, where you couldn't get a response or contact a practitioner. It was just miserable. Since about 10 years ago, they've completely changed. And any patient that I say needs general anesthesia, that has any medical qualification, they approve to go to the OR. It's seamless. It's just seamless. And I can just say, the whole hospital support system. So this is a Kaiser commercial, but I just did a patient last Thursday, special needs, had to extract all his teeth. He was completely overwhelmed with that feeling when he woke up, refused to eat and drink. If it were in Sutter or Mercy, it'd just be a major pain to get that kid admitted for hydration. Kaiser just takes him back in, hospitalist takes care of it. It just needs to be seamless. The paperwork, you know, I have patients, and Rodney knows this, I have charts that are 1.5 inches thick of paperwork for pre-authorizations going over 6 to 9 months to get some patients in the hospital. It's just ridiculous. And I'd say that I'll pick on Liberty. Liberty has changed, but it's still, patients come to me and they've been referred to 3 or 4 different offices within the system before they finally make it to me over the course of a year and sometimes 3 years. And these are pretty aggressive parents that are pushing the ball up the hill. So, you know, these patients should be recognized early and just be streamed into getting care or getting evaluated as soon as possible. That's me.
Thank you. That's why we asked Liberty to be here. If there are stories, we work really hard every day on fielding these phone calls and complaints and triaging, and it's getting better, but you're right, we can continue to be better. So.
Well, Liberty's one of the best. We've had a great conference call about 2 months ago about a patient, and it's been very productive since then, and my hat's off to them. They've streamlined it quite a bit.
Yay. Okay. Any more questions? We want to move forward? We're right on schedule. Dr. Bughao, it's your turn.
Oh, all right. Well, I was asked about hospital dentistry and where I draw the line as far as when do we actually bring someone into the operating room. And for the most part, I really would encourage, first of all, the general dentist to get out there and try to treat these patients. Yes, it's scary, but as you've heard from Mary and Dr. Acheson, there's help out there to help you get acquainted with treating people with developmental disabilities. It can be slow, it can be disruptive, but it can be very rewarding as well. So first of all, I'd say, you know, give it a try. Can you do a visual exam? Can you take x-rays? Can you do a simple prophylaxis? Can you do an anterior restoration? If you can do those things, that's great, because that means, you know, perhaps this person can get sensitized to get more definitive treatment as they go along. But then I want to caution is, if you can't do those things, then it really is time to refer for hospital dentistry. There's been countless times where I'd have a family come in, and this is the first time I'm seeing the patient, and they say, well, you know, they go to Dr. So-and-so every 6 months for the last 5 years. And then I get them back to the operating room, I take x-rays, and there's rampant decay everywhere. So the patient's family has been given this false sense of security that they've been getting all this dental care, and then I come out and I say, we did 15 fillings, and now I'm the bad guy because I'm doing all this work. And the other thing that's a little bit frustrating is, like Dr. Acheson was saying, you know, you get patients who come in, whether they're there because of a developmental disability or if they have medical issues, is that they don't have that family support. I notice a big difference in the care of my patients because most of my patients have developmental disabilities. Some of them come from the care homes in the area. And I notice clearly that the oral hygiene there is not as good as it is when a person is with their family. So that's an area I think maybe we can work on it and try to help improve. So the reasons that we bring these people in is because they can't cooperate in a normal dental setting, but where do we bring them becomes another complicated question. A lot of it, almost all of it actually depends on their medical insurance, and who covers the medical insurance will determine which hospital system you can enter, which surgery center you can enter. And as Guy was saying, the difficulty in getting these cases scheduled, it takes a tremendous amount of man hours to get things going in the right direction. And as Guy was saying earlier, there's nothing but hurdles in our way to try to get someone into the operating room. Understand the operating room time is expensive, but the access that we have to them is just inadequate. you know, a lot of my patients I want to see every 12 months because they can't cooperate in a dental office. They are very combative at home with oral hygiene. And then I see them, I work hard to get things back to a baseline or a benchmark, as Dr. Acheson was saying. And then to see them in 2 or 3 years because we couldn't get them in fast enough, and to see all the destruction just start all over again. It's a very frustrating feeling to see that when we know that it can be prevented. It seems to me, you know, the people with developmental disabilities, there just seems to be, I don't want to say discrimination, but it's really difficult for them to get the care that they need. Where if someone who is quote unquote normal, healthy, wouldn't have that problem entering the hospital system. So I think there's work to be done. And like Dr. Acheson was saying, Kaiser has come around, and when everyone buys in and everyone's working towards the same goal, it's a great feeling. We get in on time, we get the time that we need for the most part, the follow-up care is there, and everybody's really happy. So that's what I do. I don't know, is there any questions? I'm not sure.
Do you have any questions? We will have some at the end, don't you worry.
Okay.
Okay, we're good. Thank you so much. Thanks for what you do. All right, Miss Sonia Bingaman, you ready? Hello. We have Sonia on there?
Yep, I'm ready.
Okay.
Hi. Thank you so much.
With that headset, go. You go.
Okay, well, thank you so much for having me. This is just such a great discussion, and I just, Dr. Acheson just really brought it home with the heart, and these are just individuals who, you know, want the same treatment and same health that all of us have. And I wanted to reiterate Mary's points of, you know, if somebody hasn't had any interaction with someone with a developmental disability or disability, to reach out. There's lots of us who have access to families, who support families and individuals, and we'd be more than happy to either meet with you or your staff, or introduce you to individuals with developmental disabilities and their families to, you know, just have a conversation about what are some tips, what are some ideas for what can be done to support folks. And majority of individuals are, you know, if you take that extra minute or two to get to know them and talk to them, they'll comply with whatever you want in the dental setting. That, you know, they're not, the majority of folks are not contrary, and they want to do and they want to please you. And so I think taking those few extra minutes to get to know somebody can make a huge difference. I do want to try to share my screen, so let me try that right now.
Yay! So far, so good.
Okay, let's try this. Okay. So I do work for the State Council on Developmental Disabilities, and we are a federally and state-funded agency. And we are not the regional center. We are a separate agency. In the past, we were part of having some oversight of the regional center, but also primarily to help people learn what their rights are and what services are, and help them to gain the skills to access services and advocate for themselves. So we do a lot of trainings and a lot of conferences and a lot of connecting people and a lot of collaborating. And we don't just represent and work with people with developmental disabilities who get services through the regional center, but also those who are not connected with the regional center, but may have a developmental disability. And there's about as many folks in California, about 350,000, who are not connected with the regional center as who are. So it is a broader group of folks in California, but there's also a lot of other people who are not eligible for regional center services, who have various either medical or psychiatric or physical conditions, who also require some specialized care when it comes to dental services. It's not just developmental disabilities. So maybe someone who has seizures, or someone who has a traumatic brain injury, or just anxiety. So there's a lot of individuals who the the dentists are seeing who need some extra care, or like Dr. Acheson said, other people who are just traumatized from previous dental care who are afraid. So it's not just individuals with developmental disabilities who need a little bit of extra care. Within California, though, we do have the regional center system, and so they are a great resource. And when you're having challenges, or you think that maybe the family is not going to have good follow-up to a procedure, like Dr. Acheson mentioned, that would be a time to maybe reach out or ask them if they do have a service coordinator from the regional center, and maybe that person could be connected, and there could be some discussion about what other supports can be provided to the family, and make sure that there's some follow-up happening, and other supports for the family for dental care and hygiene. A few years ago, when we were having some issues in Sacramento, and at that point Sutter was reducing their access to the OR for special needs dentistry, we did a statewide survey of families and got input from about 50 families on their experiences and individuals. And these are a couple quotes from them. We still cannot find dental care, and my child's 23 and is on my PPO, has Medicare and Medi-Cal, and has had a mouth tram, so now she has no teeth in the front. Another quote, my son's 21, severely developmentally disabled, has private insurance and Medi-Medi. The only dentist I've been able to find to provide dental care for my son is Dr. X, that is Dr. Bughao. The office handles all of the paperwork and the insurance approvals and hospital and anesthesia set up. Without them, we would be lost. Most dentists won't even try to get in my son's mouth. So these are just a few comments, and this again is a similar situation where families having to wait, several years to get care just because the paperwork process that Dr. Acheson mentioned takes so long. Individuals are not being able to get in routinely for preventive care. And so that's an issue we see from families saying, well, instead of coming every year, it's really every year and a half or every 2 years because the process just takes so long. And then of course, by the time the dentist gets in there, there's more problems. So there's a lot of issues beyond autism, and autism is one of the developmental disabilities, but cerebral palsy and epilepsy and intellectual disability are all part of developmental disabilities. It's a very specific definition in California. And so there can be a host of issues, dental issues, that are a result of developmental disabilities. And so autism often brings we see some of the behavioral issues, but there's a lot of physical issues that will affect dental health as well. I'm not going to go through all of these. My PowerPoint can be shared out, but these are just a lot of the issues that someone may see with someone with a developmental disability, effects of medication or maybe over medication over the years. Effects of trauma. We have a lot of folks living in the community now who lived in developmental centers earlier. Maybe they didn't have the best dental hygiene then, trying to take care of themselves, or maybe in the community they had some sort of trauma, anxiety built around from that. There could be physical issues from development. Cerebral palsy, there's a lot of unique issues related to cerebral palsy, ability to swallow, saliva issues that can affect dental health. So there's a lot of issues beyond developmental issues that a dentist would want to know about, and maybe get to know that individual more beforehand so that they could be more prepared before they look in someone's mouth and see something they may not be used to seeing. I also want to mention about intellectual disability, and that is across the board a commonality of most individuals with developmental disability, that they also have a co-occurring intellectual disability. And that may make it hard for them to understand the process, understand, first of all, preventive care, proper dental hygiene, following through on that at home, as well as understanding the process of being at the dentist, and follow-up care. There may be fear, there may just be not understanding the words that are being used. We need to simplify things, we need to use plain language, we need to slow down in what we're doing. Show the tools, show the chair, explain what things are for. There's a lot of things in the dental office that can be quite frightening for all of us. And so just simplifying things and really seeing where that person is and what comfort level they have in the procedures. I was just really thrilled to work with Donnell. We started going out to some of our local day programs and doing basic hygiene presentations, and Donnell is just amazing. She connects with people with developmental disabilities, as she does with everyone that she does presentations for. And you know, at the end of an hour-and-a-half presentation, everyone is on board with giving it a try and brushing twice a day and flossing and all of that. But it requires follow-up, right? You can't just go out and do a presentation one time and expect it to stick, because how many of us actually floss our teeth every day, right? So these things, they require repetition, right? They require support from the care providers if they're in a care home, from staff if they're living in an independent living situation, or from the family. And we know throughout the state, about 80% of people with developmental disabilities do live with their family. So if we can get the family on board, if we can get staff at a care home on board, that will certainly help. The other thing that Danielle and I realized when we were going out and seeing this room of 20 folks and they'd all smile, we were 50 years too late, right? We need to start much, much earlier. We need to start when individuals are born and are identified with a developmental disability. We need to be giving information to the parents and following up. It needs to be part of early intervention. It needs to be part of the annual meeting that they have with their social workers, because these issues, at this point, when we go out and do a training for someone who's 50 or 60 years old, we've missed the boat. But many of them could start, doing proper hygiene, but there's a lot of years that have gone under the bridge at that point. I'm really excited about the direction that things are taking in Sacramento through McDAC. There's just so much energy and support about serving this population and making sure that they're not ignored, that they're honored and recognized, and that we can do everything we can to help them access the dental care that they have insurance for, and the state's paying for insurance for many of them, right? So can we help them actually access that? Some of the things that we're working on with the McDAC committee are just ongoing training and support of dental providers, like tonight. This is great. Development and distribution of oral health education materials for the dental providers, as well as for families, for individuals with developmental disabilities. Some great handouts are in the works that we can help to distribute. Support for parents and care providers to appeal denied treatment authorization requests. We can't just let that happen, right? I mean, if you or I had dental pain, I would expect to get into my dentist within a couple hours, right? And we're talking about months and months, and sometimes up to a year that goes by that we're talking about these issues, and we forget that they're individual people who are in pain. So everything we can do to help families to appeal those decisions, to help the dental offices and the dental staff to go through that process is just essential. Support for dental, yeah, I mentioned that one. Families to seek support in navigating dental services from the regional center. They can sometimes get some help through the regional center. So we want to, if they do have a regional center case, we want to encourage them to contact their service coordinator. Some families don't realize that the regional center is involved with that, and can help with accessing dental services, in some cases to help to pay for some dental services. Continuing to support and advocate with Department of Health Care Services to improve access, and sometimes improve reimbursement, because we know that that helps as well. To continue to offer more desensitization training at all ages for children and adults. And in some places in California, there have been specialized clinics that have been set up for years that have helped individuals, and they may go through this for a year or multiple years. We haven't had that in Sacramento. So anything we can do to help have more programs locally that will really help people on an ongoing basis to be able to access care in the dental office instead of having to have hospital dentistry. Let's see, I think I've mentioned everything else here. And finally, to continue advocacy to increase OR time. Many dentists, we have some dentists who are willing, and getting that time is just very, very challenging. So everything we can do to support them to increase that time will be great. And it takes all of us working together and also separately. So I just really thank everyone who's put on tonight's event, and all the dentists who are interested and willing to serve this population. Again, just imagining it's someone in your family who's in pain and wakes up that day, and maybe they're not using words, maybe they're hitting their face, or maybe they're hitting their head against the wall. And it may take a long time for a family member or care provider to actually understand where that pain is coming from. But we would all expect that we could get treatment as soon as possible. So again, thank you so much.
Thanks, Sonia. We have some questions in the chat. Jen, Noel, you want to read them off?
Hi. Yeah, sure. So one of the questions is for Dr. Bughao. Are you based in a specific hospital or facility?
Yeah, I was just responding to that. I work at Kaiser, Sutter Medical Center, and a couple of surgery centers in Northern California.
Great. And then I think actually, Dr. Bughao, you had a question. Does Dr. Harris have hospital privileges at Kaiser?
Yes, I understand that was a no. We can help, I believe, but we would definitely want to have her primary care physician involved because of the medical history. Definitely needs a little extra attention.
Thank you.
And then Dr. Chow asked Dr. Bughao, are you in a specific hospital or facility?
As I mentioned, yeah. Kaiser's, Sutter Medical Center, and a couple of surgery centers.
And you definitely have an office too. Do you see patients in your office?
Just for occasional visuals, but we don't do care in the office.
Okay, perfect.
And then to the next question there about Santa Rosa Kaiser, if they don't have a dentist there, I go to Kaiser in Vacaville. And so we see a lot of patients from the regional center out there at Kaiser in Vacaville.
So Dr. Hom, in Santa Rosa, Dr. Acheson, can you weigh in? What is the facility in Santa Rosa, or the one that sometimes you work with, the foundation in Windsor? Do you know about that? Or Dr. Bughao, do you know about the Windsor facility?
Yes. Is it Windsor or? Yeah, I want to say the TDI, but I know that you mentioned that earlier, but it's something like that.
We'll look that up for you all.
I'm getting old.
Don't, hang on. So Tammy, interesting that you're asking about vendors at Alta Regional Center. I've been in discussion with them, with Mary and about 5 other people. Oh, there you go, Dr. Hom. Thank you very much. It's Windsor PDI, Pediatric.
There you go.
PDI. So Tammy, we are working with Alta Regional to expand their vendor list. And that's one of the reasons we're getting together here. Right now, there is only one Donnell vendor, and there's no reason why there can't be more. So the credentialing process, we have been very strong about telling Alta to make sure that they work a little harder and with us to get more vendors, so that they can do more. They can do crowns, they can do root canals, and right now I know the vendor list is very low. So we're working really hard with Alta to try to expand that vendor list. So glad you mentioned it.
And I can just add to that a little bit too, Kathy, in that if anyone that's listening is interested in becoming vendored with the regional center or Alta, all you have to do, you can go on our website and submit a letter of intent, and there will be an email box. It will give you specific instructions where to send that to. So yeah, join us.
So, and it's not necessarily just Donnell providers. I know that Alta has also reimbursements that go to dentists that is federal money as well. Is that right, Mary? So it's not just a Donnell provider.
Definitely, we have different arrangements depending on the type of service. I know we do have a couple of, what are they called? RDHAPs. I think, you know, the ones that go into the homes, do cleanings, things like that. So it just depends on the arrangement, but yes, there can be some federal reimbursement as well.
Okay, cool. All right, Donnell, your turn.
All right. Again, I'm a mom, and my son, DJ, I'll share my screen. Let's see. Well, maybe not. Try to see where I can pull this up. Okay, let's see if I can pull it up. And share screen. Oh.
So Jim Morris, you're next, and don't worry about being a little bit late. I've built lots of extra time into this. We are like right on schedule. Oh, okay. There you go.
This is my son, and this is, we were privileged to be able to share in some advocacy work, trying to get some dental care for not only youngers, but also olders at the Capitol. And I'll leave that there, just to let you see that. But my son, I had shared before, he has Down syndrome and autism, and he has a wealth of medical challenges. So he received his care in the hospital. But I am an advocate in the community as well, and I hear from parents all the time who believe that that's the only thing that they need. And yet I know for many kids, if dentists would be willing to accept clients that have special needs, they can work with them. And so some of the things that have been mentioned are really, really important. Like for my son, we use a visual schedule that tells him what's going to happen. I often take pictures when we're in the hospital of him, and then so I use them to remind him this is what's going to be happening. And we have a funny story to tell. Things are so boring around here. He's not at day program that about 3 or 4 days after he had his last cleaning with Dr. Bughao, he told me, let's go hospital, let's go see Dr. Bughao. And he really, that was the highlight of his life right now, was going to see Dr. Bughao for a cleaning. AutismSpeaks.org has a great questionnaire to look at. I'll leave that in the chat and when I get done here. And they have a questionnaire about what things you can ask the family. I know Dr. Bughao uses a questionnaire because families know the best about their child. And it really means a close relationship that you need to develop with the family. You know, you're here today because you'd like to expand your practice, I believe. And if we insist on only working with people that are typical, that are like us, then we're really not serving our community. We need to look at a broader picture, and at least 5 to 10% of people in a population anywhere have special needs. So we need to make accommodations. I have a hearing difficulty, so I often have to say, can you speak up? And, you know, people are more than willing to do that. But when I bring my son somewhere, sometimes because of the way he looks with his Down syndrome or the way he acts because of his autism, they're not sure and they shut down. That's their problem. But I know you're here today to learn about ways that you can expand your practice and meet the needs of the community. Some of the other things that were shared, we use visual stories and rewards for him, helping him to know what to do at times, and sometimes bringing a fidget toy or a video tablet, even a video, making sure the dentist knows ahead of time that there's you know, your kid is into SpongeBob SquarePants. If you could have that video on, that will help my child to settle more. It does mean sometimes shorter visits, and that you talk to your child about the fact that, talk to the child and the family to tell the child. The dentist is there to count your teeth, and so practicing counting at home with your child and letting them know what you're doing, and becoming routine to where they let the provider get into their mouth, letting the parent get into their mouth. My first experience when my son was about 2, I knew that he needed dental care. His teeth came in all crooked, which is very typical with children with Down syndrome. And I asked my regional center, it wasn't Alta, I lived somewhere else at the time, could we get somebody to help us? And they sent us a hygienist out who proceeded to tell us to wrap some tongue depressors with tape and wedge it into his mouth and force his mouth open so that I could brush his teeth. I didn't think that was going to work with him, especially because he was extremely sensitive and would projectile vomit over anything that went into his mouth. So that put him at risk for other problems. When we moved, when he was 3, we came here and I received a referral to Dr. Bughao. And that was where we really started our dental journey that was positive. So it helped us a lot. Children who have special needs often learn visually more than they do auditorily. But when you get to know the family, you get to know those things. How does your child learn best? And so we use the visual pictures and the little icons that are easy to find nowadays if you just Google it. And but I also agree that hospitals are partners in this, and sometimes they make great barriers that make it really, really hard. One of the things that we do to help ourselves when we go into the hospital is I have a medical chart that tells about my son. I put it up on the screen so you can see it with a picture. Tells about him, all his diagnoses, his allergies, his current medications, and history of what's happened and his doctors. And so that, as a parent, that is one way that I arm myself when I go in, because a lot of times you're taking an oral history as provider, and those of us who have kids have long histories, it's really hard. There's always interruptions, but I know whenever I share this with the professionals, especially Dr. Bughao knows him really well, but we usually get a different anesthesiologist. They're always like, wow, this is so helpful. So as parents, we can help to inform and anticipate those questions as well. I think we can do better at reaching families in a lot of ways. You know, they are, let's see how I need to undo my screen. I'm not sure how to undo my screen now.
Undo your dream. What do you mean?
There we go. I hadn't learned that one yet. And I'm going to put up the website or the chat that tells where the information from Autism Speaks is. My son has developed a relationship with Dr. Bughao to the point that he's like, I'm willing to go back and see him in the middle of COVID. But it does mean developing a relationship. It means taking time. But these are people in our community. And not only are they individuals, but they have parents, siblings, grandparents, aunts and uncles. They have friends in the community. And I'll tell you, on Facebook groups that are hosted for those parents with special needs, often I hear, where do I go? My child needs dental care. I have calls from parents. I don't know where to go. Where do you get your care? And this is not an area that parents want to have something bad happen in, because they know the ramifications of that. They want to have a positive experience for their child. So I appreciate you taking time today to explore what the options are to desensitize families and individuals with special needs so that they can access dental care in the office, and when it is needed to do more and go for general anesthesia or whatever, you're in a position to help and to advocate for them. Thank you for letting me share today.
Thank you so much, Donnell. Does anybody have any questions for Supermom Grandma? How old is DJ, Donnell?
He's 25 now.
Okay. Okay. Anybody have questions? All right, Jim Morris, you're next.
Well, Kathy, I must say I am impressed with the scope of expertise that you collected for this program. And what occurred to me immediately was that our Parkinson population has special needs that pale in comparison with other disabilities in the community. And that's just from my experience and my observation of my fellow Parkinson people. But we are an aging population, and as Parkinson progresses in our bodies, it affects us with so much more motion disabilities and cognitive and non-motion sensory issues that I think the corresponding level of anxiety goes up, as it probably does with non-disabled people just from aging. And so we've had a few of our support group members that came to me and came to the board with the question about what are my options? What do I do when I have these questions about my dental care? And so the thought that I had immediately was, well, do we go to the society and just pick up some of their brochures and have what information we need to share with our members? It's obviously not that easy. It's a lot more complicated than meets the eye. But I hope to go away with not just this information, but contacts that we can have to round up a list of options the patient should consider, and a list of the available doctors or the kind of treatment that is needed in a particular case, and be able to disperse that to our support group members. That's how I got connected with this, because we started having inquiries asking what can they do in their situation. And Bob Davey, Dr. Bob Davey, who's with the group here tonight, he helped me get in contact with you, Kathy, and thank you for including me. I'm not here to tell you a lot of details about Parkinson's. I'm here to learn what field of dentistry can help our population with that they may not know of.
So thanks, Jim. What is it that if you're reaching out to every dentist in the room here, and there are like 54 people here right now, and more than half are dentists, I'd say 2/3 at least. What would you say to them to better help understand what they need to do to prepare for a Parkinson's patient in their office?
Well, one thing they may not know, because Parkinson's patients have an array of medications they take. And if they knew when the medications are being taken by a patient and when they are on or off the effect of their medication, to schedule the appointment during the on period. We take them about 4 hours apart, and it takes about 30 to 40 minutes for the Parkinson meds that start showing their effect. If you've got tremors, if you have dyskinesia, and even non-motor symptoms, after 30 to 40 minutes of taking your medication, you start to increase your ability to handle it. And you're getting towards the top of the effect, the helpful effect of the medication. You don't want to go see a doctor when you're due to take your medication. You want to have your appointment within an hour of taking the medication. If the doctors knew that, maybe I'm speaking to the choir in that sense, that's well known with other medical issues too, I assume.
Okay, anybody have questions for Jim? I have a couple of questions in the chat room, which we'll get to. Anybody have questions? Jen and Noel, are you guys watching all the signs of hands raising, etc.?
Yeah.
Yeah, are we good?
Yep.
Okay. Any other questions for Jim specifically? Okay. Thank you so much, Jim. I'm so glad. And Bob Davy, are you on?
Yeah, I sure am.
You are? Can you raise your hand so everybody sees you? Here he is. I'm so glad you called me about this because your timing was just perfect. And as a past president of the Dental Society, I'm glad to see you back on here, and a lot of your friends are on here watching you. So you know, we keep you in our prayers for your experience and your Parkinson's journey. And thanks for suggesting this, because it definitely affects a lot of people, and I think more dentists need to know more about what to expect. So to Jim and Bob Davy, thank you so much.
We can make it a lot easier on people, I think, sometimes.
What would you have to
Especially
say?
Pardon me?
What would you have to say? What would you like? What do you want to tell
I would just like to see us treat some more of these patients simply. You know, like you had me do all kinds of different patients, Smiles for Kids and Big Kids, and they're difficult cases. So what? Do them.
Yeah.
And
so
then,
what? Do them. That's gonna be our new tagline.
And get gratification like crazy, and help people much more than you think is possible. And they appreciate it so much too. But it's amazing what you can do if you put your mind to it. That's the whole thing. Because, you know, if somebody's jumping out of the chair because they have a movement disorder, not just Parkinson's, but just essential tremor or anything, you know, then you can put them to sleep and you could do those fillings and everything. Or you could just sit back and relax and take an extra 10 minutes and do those 4 fillings and do it in your office. Save the patient and the insurance companies and everything a lot of money, and just make it a nice thing. And that kind of volunteerism, as you know, I really got a big kick out of it, and other people would too.
Yeah. Okay, thank you.
You're welcome.
Okay, questions. From Magdalene Zogopoulos, I think. My daughter does well at the dentist. She goes every 6 months. No problems, but now she needs her wisdom teeth removed. How do we know if she would have to have them removed in the hospital? How old is your daughter, Magdalene? Magdalene? Go ahead and unmute and ask your question if you want.
She's 24.
Okay.
She's been going to a dentist, a regular general dentistry, never has any issues, can take, you know, x-rays, only has 2 fillings. she's doing great, but her wisdom teeth are impacted. And now I'm hearing all this stuff about going into the hospital, and I'm thinking, wow, she has never had an issue. And like, I don't know where to go, because she needs to have her wisdom teeth out. We want to get them done while she's on my primary insurance.
And she's 24.
My private insurance, because I'm hearing all this horror stories about Medi-Cal. So I want them done while she's on my own insurance.
Yeah.
And, but now I'm hearing hospital, so how do I know? Does she need to go to the hospital, or just a regular general surgeon?
You ought to be able to go to somebody who's real knowledgeable in those areas.
Right.
And to get advice.
A general. So Dr. Bughao, what would you say? Dr. Bughao and Dr. Acheson?
Well, it sounds like her child's moderately cooperative. I think most oral surgeons are skilled enough to start an IV and do that case in a regular oral surgeon's office.
Okay. Yeah, she's never had an issue. She does x-rays and herself, she takes the x-rays, she does everything, and I don't know if it's because of COVID, but the last time she went to the dentist, they gave her the fluoride to put on her teeth herself. Is that a new COVID procedure? They told her to put the fluoride on herself at night, which she did. But yeah, so I just was, hearing all this stuff about going to the hospital just got me kind of scared,
So Magdalene, I'm going to send you a couple of oral surgeons' names.
Okay.
I don't know what your insurance is, but you can call me at the office tomorrow.
Okay.
And we can go through, some other referrals for you. But it sounds like you can try an oral surgeon's office, and probably she'd do great. Not a child anymore. She's a young lady, but
right.
Okay.
Yeah.
Okay.
Thank you.
Okay. Thanks for being here. How'd you hear about this?
Sonia sent me an email.
Cool. Okay. All right. So do we have any other questions? Hi, Donnell. Go ahead.
I just wanted to point out to Madeline and others, always assume that your child can do it. A lot of times parents decide, oh, my child would never do an EEG or EKG, or they would never let them do this. Always wait and see if they're capable, and be as positive as possible so that they have the best ability to be successful, and then see, because our kids surprise us all the time. One of the reasons my son goes into the hospital is he has heart and lung issues, and so that we know that's what he needs, but there's lots of kids who can do lots if we will give them the tools. Take a little bit of time, and obviously your daughter is doing very well, Madeline.
Dr. Acheson, did you have anything else? You had your hand up.
Yeah, well, first I wanted the Parkinson's patients, just that tip that they can time taking their medication before they come to the office is just huge. But the concern about, there's all these questions about wisdom teeth, and people need to know that oral surgeons are kind of in between an anesthesiologist and a dentist. So most of their offices are set up as basically same-day surgery centers. So as long as patients are medically stable enough and have good lung function, they'll probably be able to do the sedation and everything in their office. But the primary, I think, criteria, and Rodney can ping in on this, is when you're sedating somebody, like in an office, you're really concerned about airway. The patient has to be able to breathe, and they have to be able to have enough flexibility in their neck and head that if something were to get in their throat, you could tip their head way back and be able to look in the airway. And people with scoliosis or muscle rigidity or very limited opening, that's danger. And those are some of the primary things that I look at, and it's time to go to the hospital, mainly so that you have all the resources available if you need them right then and there. So, but most professionals, I think any oral surgeon could give you a real clear answer about whether they're going to do it in the office or whether you should go in the hospital.
Okay. All right.
I guess one other thing for all the practitioners that are thinking about special needs patients, if you do this, I really suggest you plan for it. Put them at the end of the day. Don't put them in the middle of your busy schedule. You know, it should be like the last patient of the day and schedule twice as much time as you normally would, so that it's just going to not turn out to be a disaster with your assistant thumping their watch that they got to see another patient, or that you're feeling rushed. You know, make it a win-win situation. Tiptoe into it. I think that would be great advice.
Advice. Would you agree with that, Mom? Patience. Yeah.
Good advice. I would want to add, just to treat each person as an individual. I go to a dental office that's like stuck in the 50s, right? Nothing fancy, just this small waiting room. It's as boring as could. There's like a Good Housekeeping from 1945 in there. And then I go with my son to, you know, to get his braces, and there's like jungles and paintings and videos going. That's great for some people. It's not great for other people, right? So each person is different. And I know a lot of people who would do much better in my dental office where it's quiet. I'm always the only one in the waiting room. I get taken in immediately. There's no wait. And so you have to think about that too. Each person is different. One person might love that stimulation, might want SpongeBob playing. Another person might prefer quiet. And I love the advice of, you know, book them at the end of the day or the beginning of the day, or some time that is going to be, you know, set aside to focus on that, so that person does not have to wait and get anxious. But each person is different. I do a lot of trainings with police officers and about autism and developmental disabilities, and we just have to remember each person is different. You know, interview the parent over the phone, find out what's going to lead to the most success for them, because each person may really respond differently to the dental office.
And I'm going to go back to what I said before about repetitiveness and making the visit to the office routine. And it's so fundamental for prevention, because what we really need to emphasize is prevention more than anything else, because we don't want to do these difficult interventions. And as I shared before, that's how I learned to really understand and appreciate all the uniquenesses of every individual. And you have to see them repeatedly. You know, you're the parent, you see them all the time, but this poor dentist is just like getting a 5 or 10 minute snapshot. And if they only see that patient once or twice a year, they aren't really learning much, or it's going to take 5 years to really learn the uniquenesses of those individuals. Where again, you know, the fluoride varnish routine, bringing them in, you know, you really begin to understand how they communicate, what they're sensitive to. Frequency is really important. So in my office, Fridays and Saturdays are pretty much my special needs days. And, you know, so we're not stressed out having, you know, all these patients that are uncomfortable being in the waiting room with special needs patients, that are uncomfortable having wheelchairs in the waiting room. You know, that's just Friday and Saturday at American River Dental is, you know, transport day, every conceivable way of trying to move patients around. Anyway, those are my thoughts.
And one of the things we didn't touch a lot upon, but I think what Guy is bringing up and Sonia are some of those sensory sensitivities that do come so often with an autism diagnosis or developmental disability diagnosis. And so having something like a comfort menu, right, for anyone, honestly, my dentist has a comfort menu. I love it. It makes me comfortable, where they offer things like, you know, sunglasses, headphones, chapstick, a blanket. You know, it makes you just have this very cush environment, or can be sensory dampening as well.
For every patient.
Yeah, my dentist said one time when I brought my own earphones, "Oh, we have those, but we've never offered them to anybody."
So we have a question from Magdalene. Do you want to ask your question?
What my adult daughter has the AAI, the neck instability that sometimes that's common among Down syndrome. And so would someone that has the antiaxial instability, would you, asking the dentist, would you recommend that they go to the hospital for their wisdom teeth to be removed?
I see Margaret here. Margaret, do you have an answer for that?
This is Dr. Delmore, who's an oral surgeon.
Oh yeah, I do.
Hey.
So she's got Down syndrome and that instability. Is that correct?
Yeah, she's been diagnosed with having an AAI,
right.
The axial instability.
So she would be a high risk to do a sedation in an office because of the airway.
Okay.
He is much better candidate, much safer to do it in a hospital environment.
In the hospital.
Yeah, I'm going to tell you that outright.
Okay.
I mean, if I was the one treating her, that's how I would do it. Just it's a safer environment for her.
Okay.
So Tammy, a lot of oral surgeons, I have privileges at the various hospitals. So when you call to have an evaluation with the oral surgeons, just let them know. And almost everybody has privileges in the hospitals.
Okay.
Depending on if they take your insurance or not.
All right.
Okay. So Tammy Bradley, you have a question?
Oh, I just wanted to first of all say thank you for this opportunity. It's been amazing to know that there's so many people out there willing to work with folks like me, and it's been a real struggle with COVID to get into a hospital because I do need a hospital setting with all my medical issues, and then finding someone that was comfortable working with all of my limitations, even just to get in to see somebody. So I just really want to say thank you. And I guess my only offer of advice would be just take the time and really listen to your patient or your parent or whomever is speaking about the person's needs and disability. And I know that I'm very articulate, but sometimes I have anxiety. And so trying to balance that with being able to give my needs met, sometimes that's really a fragile balance. So that would be my one offer, would be just really take that time and get to know your patient's needs, and we work great together then.
Awesome. Thank you. I'm privately messaging you too.
Thank you.
Mm-hmm. Okay, anybody else have comments? This is so good. All right, Donnell, I love your comment. You want to say it publicly?
Yeah, the hospital's not scary. I know it, if you're not used to it, it's like, oh my, but it's not scary at all. My son has had, oh gosh, I think it's around 15 visits just to have his teeth cleaned. And the hospital, it is a partnership with the dentist and the hospital and all. And so you have to go through that process, but they are so supportive and positive. And sometimes when you need them, we've had child life specialists when he was younger come in and help us, that we've had offers of what can we do to make it better for you. So it's a positive experience, and one that, really your child might have to go to the hospital other times. So this is one time they're in and out usually. And so it's good. It's good to have that experience, and they very much listen to parents. So.
Thank you. Anybody else? Dr. Keating, you're on here. You can't go yet. So Dr. Kevin Keating's on this call. And have you unmuted yourself?
I am.
So do you want to talk just a little commercial about California North State University and the dental school and the hospital plans that you guys have? Because we talked a little bit earlier
Yeah,
about.
sorry, putting on a better microphone for you there, Kathy.
Okay, so I'm
Apologize.
stalling a little bit so you can get, I see you fidgeting.
Thank you.
But you know, we talked about the OR time and the hospitals limiting OR time and whether it's Donnell or whether it's private insurance. I know Dr. Bughao finds a lot that the OR time is being reduced and reduced and reduced, especially with Donnell Medi-Cal. So if you could just talk a little bit about your plans at California North State and the clinic and hospital that you guys are planning.
First thing, we're in the process of building a College of Dental Medicine affiliated with California North State, which is got two campuses, one located in Rancho Cordova, which is an undergraduate campus specializing in health sciences for all those interested in a healthcare career, whatever it might be. The medical campus that's under development, we've got a College of Pharmacy, College of Medicine, College of Psych, soon to add a College of Dental Medicine, but the accreditation process is incredibly onerous and COVID has set us back. We had hoped to have our first dental class for beginning dental students this year, but COVID has postponed accreditation for at least a year and possibly even 2 years because the COVID has just impacted education and all the health sciences around the world in ways that would be unexpected. So long and short of it is our vision for the school is to offer a College of Dental Medicine because we're dealing with much more medically complex patients today. And so the goal is to have a better medical foundation so that we can take care of more patients that are medically compromised because we are dealing with a less healthy population in general in the United States. The first two specialty programs, so we're going to be spending probably 4 or 5 years building a basic knowledge of dentistry. And then once we are accredited and fully accredited, the two specialists we plan on bringing on board are special needs, which covers all the things that you're talking about, in oral surgery, because those are the two specialties that predominantly focus on one area, the greatest need in the Central Valley, which is special needs and access to for those that population. So that is the long-term strategy, or actually the near-term strategy. The long-term strategy is adding all the dental specialties, but that'll probably be a 15, 20-year growth in the program over the years. My goal right now is to get the College of Dental Medicine up and running. Margaret Dillmore, who's on the call, is one of the trustees. Wai Chan, I saw him, was also one of the trustees. Also very involved with many others on the call for trying to plan this. Rod and Bughao and Guy Acheson have been part of our strategy going forward for developing special needs program. We've got several individuals who are interested in starting the oral surgery program. When we get to that point, we've got several individuals who've got hospital dentistry experience, interested in starting the hospital dentistry residency, the special needs residency. So we have a lot of things that are all to try and address some of the critical shortages that are clearly evident in certain communities within the greater Sacramento area, but the Central Valley is really a larger target. So we hope to get accredited this next year, but that whole process to go through the U.S. Department of Education, when every dental school around the world, every medical school around the world, every healthcare school around the world has been impacted in healthcare just because of this COVID crisis. So it is a big adventure. It's affected all of us individually in ways we wouldn't expect, but it's also affected our students and ways we don't expect. To have to cancel a class this year, and there's a lot of disappointed kids out there, but there's also disappointed faculty and administrators that are staring at the ceiling going, okay, what do we got to do to make it safe to provide an education for beginner students? When I say beginner students, new dental students are all, we have to consider them as, even though they got probably, college education, college degrees, they're still beginners in the healthcare industry. It's true for medicine, true for all the healthcare specialties. To try and make it a safe environment for them, safe environment for the faculty, and most importantly, a safe environment for the patients that we treat. So lots of changes going on. Yep.
You weren't on the agenda, but I called on you, and I bet you're babysitting your grandchildren.
Could you tell? I mean, all of a sudden, yeah, it's
That's all right. You can go ahead and mute yourself now.
Okay, thank you. I will.
All right. No, I just figured I called on him. He wasn't planning, and so it's my fault I called on him. But he's got twin grandkids. I think he's got 4 or 5 too. Screaming kids alert, we got it, but he was speaking, so we can't mute out the grandkids. So thanks for being patient, everybody. So, any final questions? Okay. If you need to call us at STDS, our phone number is 916-446-1227, and we will be here from 8 o'clock. Okay. And Tammy, I'm gonna send you a little message as well. We are going to be sending you a survey, and at the end, I'd love your opinion. I'd love your suggestions of anything further. I wanted to, let's see, obviously the purpose of this is to get more dentists to integrate, and as Dr. Davy said, who cares, get it done, right? Is that how he said it? Who cares, get it done. And I think that's a great tagline. And we don't want our patients or your kids or your adult kids or your grandparents or your parents to be afraid to go to the dentist. And then again, we don't want our dentists to be afraid either. They're afraid of everybody, special needs or not. And they don't want to, as you saw with Dr. Bughao and Dr. Acheson, who spoke so from the heart. I mean, they want to do the best for our patients and their patients, and their hearts are in it. They're not just punching the clock in the dental office, and I can say that firsthand. So they really care, and those of you who are maybe learning that this isn't scary and you might want to try it, I hope we've done our job to say, open up your hearts and thank everybody for sharing their stories. And Robin Alonji, are you still on this?
I'm still here.
Can you explain one last thing what MCDAC is? Because some people mentioned it, and there are a lot of people who don't know what MCDAC is.
So the legislature created MCDAC many years ago. I don't know the exact date, but it's the Medi-Cal Dental Advisory Committee, and it's a group of community stakeholders, public health or public members, dentists. There's certain categories that have to be filled by members of the community, and they work on increasing access to care and solving problems like the dentists were talking about, the problems with the insurance and not getting approvals in a timely manner to allow patients to have the anesthesia that they need to get their dental work done. So that's been an ongoing issue that MCDAC has been working on in SDDS and Dr. Bughao and Dr. Musser for so many years. And I think we're finally making progress on that. But they're dealing with a lot of issues to increase access to care and solve those barriers to care that not just patients with special needs face, but the community faces. And I think Jan, if she's still on the phone, may be able to add to that. But that's the quick and dirty of MCDAC.
Perfect. Perfect. We're all trying to do better.
Yep.
And if you haven't signed in the chat to tell us you're here, please do so after you do the survey. And speakers, please do the survey as well. Give yourself a nice high rating, but everybody else too. And we will be sending you, if you need CE, we will be sending you the CE. And I think that's it. Does anybody have any last things to say? Our hands going up. You go ahead and unmute yourselves, everybody. And big hugs to Liberty Dental, Health Net, and Access Dental for sponsoring us tonight. And thanks to all our speakers. Are you all good?
We're all good. Thank you for
Thank
putting
you.
us on, Kathy.
Yeah.
Thank you, everybody. Appreciate you for being here. Thanks for what
Thanks,
you all do.
Thank you.
Okay,
Thank you.
thanks, speakers.
Bye.
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 I knew it was his kids.
They can go to the hospital. Tammy, I've run into Tammy at a couple things at the Capitol. She has severe issues, and now Dr. Acheson said I wouldn't do any